One of the most consequential British Prime Ministers in modern history, a man who led the country between 2010 and 2016, 4 years before coronavirus hit the UK. Today was the turn of David Cameron to become the first politician to give evidence before the UK COVID-19 inquiry, where he was asked about the UK's preparations for a huge public health emergency. Mr. Cameron said that as soon as he took office, he was worried about public health risks and how they were being monitored. So he set up a number of different schemes, amongst them the National Security Council. That's so government ministers could be in charge and have a lookout over the various threats that were facing the country. Not just terrorism and things to do with policing, but also to do with health. Despite all that, Mr. Cameron says the government was planning for the wrong pandemic at the wrong time.
Now, the risk of a future pandemic was, as you've already made reference to, prioritised as a Tier 1 risk and remained as such, did it not, throughout your time in office? One of the highest risks that the United Kingdom faced. And although you tell us at paragraph 12 in your report that it was a pandemic that was prioritised as a Tier 1 risk, in fact, it was more discreet than that. It was an influenza pandemic, wasn't it?
That's right. I mean, I think this is maybe getting ahead of myself, but when I look at all of this and read all the papers and thought so much about what subsequently happened and the horrors of the COVID pandemic, and let me say the massive sympathy I feel for all those who've lost loved ones, and for the suffering people have felt, and the importance of this inquiry's work to get to the bottom of, the decisions that were made, decisions that could have been made, and the preparations for the future. This is the thing I keep coming back to, which is the pandemic was a Tier 1 risk. Pandemics were looked at, but there was this, the former Chief Medical Officer, Sally Davis, has said it was a group thing. Much more time was spent on pandemic flu and the dangers of pandemic flu rather than on potential pandemics of other more respiratory diseases like COVID turned out to be. And
yes.
I think this is so important because so many consequences follow from that. And I've been sort of wrestling with, well, why, I think the architecture was good. National Security Council, National Security Advisor, the risk register, and also this new security risk assessment, which was perhaps a bit more dynamic. But that's what I keep coming back to, is so much time was spent on a pandemic influenza, and that was seen as the greatest danger, and we've had flus, we had very bad years for flu, so it is a big danger, but why wasn't more time and more questions asked about what turned out to be the pandemic that we faced? And it's very hard to answer why that's the case, and I'm sure this public inquiry is going to spend a lot of time on that.
One of the ministers who was in charge of contingency and resilience planning during Mr. Cameron's time in Number 10 was Oliver Letwin. David Cameron was asked about Oliver Letwin's witness statements, in which he said, during 2011 to 2016, I was not involved in planning for a government response to an influenza pandemic. He was told by Cabinet Office officials that the UK was particularly well prepared. When he was pushed on that, David Cameron said that he didn't feel let down by Oliver Letwin. I don't think he was ignoring it. He was looking at other risks, including risks to do with the internet crashing or the national grid falling over. Mr. Cameron, interestingly, also said that Oliver Letwin was looking at slightly other wacky things, including space weather. Another thing to emerge was David Cameron's concerns about the World Health Organization. He said that they were too slow to identify Ebola as a risk and too slow to act on it. Instead, him and President Barack Obama, on the sidelines of a NATO summit, came up with their own plan on how the UK, the USA and France were going to help African nations. He says that showed that there wasn't enough planning around international health emergencies. Mr. Cameron was also asked about the effects of cost-cutting and austerity that he imposed after the financial crisis and the effects that had on the NHS and its ability to perform. This is what he said about the need for PPE and whether he was asked about it.
Hospitals in Hong Kong had to have 3 months of PPE supplies. I was never asked, can we have funding for 3 months PPE supplies for every hospital? But had I been asked, we would have granted it. That's not expensive. That's not a huge commitment. But that comes out of planning for the right sort of pandemic.
David Cameron had already faced stiff criticism this morning before he'd even walked in to give evidence to the inquiry. The British Medical Association's council chairman said there's no doubt that underfunding put patients and staff in harm's way. The Trades Union Congress said funding cuts had left the NHS dangerously understaffed. But for those who are waiting for some sort of apology for the policies that were put in place while Mr Cameron was in number 10, there was none of that coming. Instead, he defended his record and his approach to funding cuts as well as to austerity.
Do you accept, Mr Cameron, that the health budgets over the time of your government were inadequate and led to a depletion in its ability to provide an adequate service?
I don't accept that, neither on a sort of big picture level or on a small picture level. Making these difficult choices about spending it wasn't a sort of option that was picked out of thin air. I believed, and I still believe, it was absolutely essential to get the British economy and British public finances back to health.
After David Cameron had finished giving his evidence and had left the COVID inquiry, one of the barristers who's representing families of Scottish people who died during COVID-19 hit out at the former Prime Minister, saying that the funding cuts under his leadership were what led to the UK's response to COVID-19 being so poor.
David Cameron's government failed in planning for the inevitable pandemic to ensure that essential medical items such as ventilators, stockpiles of PPE, hygiene control were readily available, not only for the people at risk of losing their lives, but also frontline health and care workers who risked their own lives to save lives. A decade of austerity began by David Cameron left the United Kingdom woefully unprepared for the virus that swept its shores, while subsequent leaders presided over a carousel of chaos.
The main thrust of David Cameron's evidence today was that the systems were in place, but more questions should have been asked. Critics will say that as the man in charge of leading the country, he was the one that should have been asking those questions. The COVID inquiry is certainly going to have many more questions from many more politicians. Tomorrow will be the turn of the former Chancellor, George Osborne.